Hi, this is Dr. Avik Roy. I passed my DNB exam, both theory and practicals, in my first attempt, securing highest marks in theory. This short video is to help you guys pass your theory exam. So there are 4 keys to clearing a theory exam. 1. What you read. 2. Who you read it with. 3. How you revise. And 4. How you present your answers. First of all, you need to have a master book. A master book has most, if not all, topics. You have to build up on these master books. So which are the master books? Apley, Mercer, Varshney, Gopalan. Personally, I used Gopalan, Varshney being the most extensive master book. Coming to the subtopics, pediatric orthopedics is the most important part of your theory as well as the clinicals. I used Gopalan as well as Turek. For spine, I used Gopalan and Turek. For trauma, I used Koval supplemented by Rockwood. For arthroscopy and arthroplasty, I used Campbell. For arthroscopy, I used Insel and Scott, but it's up to you. It's not mandatory. For TB, there's no better book than S.N. Tooley. And for your clinicals, you need to read Cases, a book called Cases by Professor Anil Bhatt from Manipal. I cannot stress it enough. You have to have a study mate. Be it your batchmate from MBBS who is from another institute or your batchmate from your own institute. You have to have a study mate who will push you when you don't want to study. You need to join a WhatsApp or a Telegram preparatory group. Every time there is an exam, group pops up here and there. So you need to join those groups. The use of these groups is that there will be sharing of notes, and not all answers which are asked in the theory papers are present in your standard books, and you can't write all the notes, so you need help of others. Most important part of an exam-oriented study is the revision. Studying without revision yields minimal or no output. So how do you come to revise? You have to make 2 sets of copies. 1 for cold and 2 for your traumas. Whichever topic you come across, which has a classification, you have to write down that classification as well as the treatment. Read it as often as possible and then quiz your study mate. Questions asked in the DNB are structured. So if you know the classification and the treatment, you know the topic. Even if you miss a few details here and there, it doesn't really matter. You know the topic. The final hurdle, how you present your answers. How you present your answers decides your future on D-Day or examination day. So how do you present it? You might know your topic, but you have to show your examiner that you know the topic, you're clear in your concepts in the briefest possible time. If you write your answers in points, if you use diagrams and flowchart to explain your answers as opposed to writing in paragraphs, that will fetch you much more marks. Trust me, these people in DNB, they love their diagrams and their flowcharts. Management. There are 10 questions and 3 hours, that is 180 minutes. So you have 18 minutes per question. I'll advise you to take 15 minutes per question so that at the end of your paper you have 30 minutes for revision. If you've left a question, if you suddenly remembered something, you can add on to those answers. And finally, you should never leave a question. Write whatever you know about the topic, write anything you want, but do not ever leave a question.